Marriott.
Oh,
Wait, is it bad?
No,
no,
it's fine.
shoot, you're
It's
back.
great. Hello, America. We are live. We have promised this time to introduce ourselves instead of diving right into it. So you all know that you are actually talking to Kat McDavitt, Lisa Berry, Melissa Danino, and special guest after we go through our new show and potentially get ourselves in trouble, Krista Drobac from Serona Strategies. Are you the founder, Krista?
I am indeed. Yes.
Yeah,
Amazing.
founder power. I'm into it.
I mean, co-founder, because Kristen McGovern is my partner. So
Yeah. Awesome. Yeah, we love her, and we're excited to hear what you have to say. So you're going to be talking to us about
State AI sandboxes.
we got a slide here, a coalition to advance state AI sandboxes. So America, just wait, it's going to be totally wild. As always, we're going to help our guest out and not get her in trouble until we're done with our news show. But she's welcome to pop back on if she has big feelings on anything we're going to discuss. It's a big week. So Krista, we'll see you in a half hour, unless you choose otherwise. And Lisa, where are you at?
Where do I want to start?
What city you in?
I'm in a city, just a city on the East Coast. Just a regular old city next to a train.
We're like a
great.
mile away from each other.
We are. We're in the same city in different rooms, basically.
Yeah, but here we are. Melissa, where are you today? Did you make it to the great state of New Jersey?
Around midnight, because there was a water spout circling New York City last night, so all of the planes were delayed. But I got first class status on the way back from Arizona, guys, and I never had it for that long of a flight. And I didn't realize y'all ate up there. Okay.
Oh yeah.
Just
had a burrata salad.
Can I talk about that? Because some of you may know, or famously, as you can see by the colors here on the screen, I am a United flyer, and Kat is a Delta flyer, of course. And I decided to cheat on United last night, sort of, because United now has a partnership with JetBlue, but it's not like perfect. You don't get everything. Anyway, Oh my gosh, JetBlue, they were so sweet. The flight attendants were absolute dolls. Like, shout out to Jackie and Brandon, and just they were so nice. It was weird. It was like a change of scenery because, you don't get necessarily friendly service from United flight attendants. You get like, okay, we're going to get you to the place. Yeah. You're probably going to be alive. The end.
Yeah. This is about safety.
Safety. I'm here for your safety.
Here for your safety, not service.
That's right.
I got good food. I got fed pretty well. And also experienced a sandstorm right before I left in Phoenix. But I'm home. I'm just hiding the background because all of my clothes are all over the place right now because I was trying to.
Love that. Well, Michael, the Coffee Talk update is at the end of the news show, so you're going to have to wait on that. But we are excited to hear Melissa's readout. Also, you can go listen to that all you want. So it's on the internet, it's on our YouTube, but we'll get Melissa's update on it in a second. So, Melissa, you want to stay on, or you want to take a little break?
You can bring me back. I kind of look like I got.
Okay. Cut her off. Listen, we got a long show. We got a lot of news that happened. Okay, let's see what's going on. It's a lot.
We do. But I have one question to start, Kat.
Oh, what?
What is communism?
Oh, you guys, I would like to tell. So I know I often joke about communism on this show because I am not a communist, and I believe in capitalism, and I really prefer to make money and not pay as many taxes. So. But you may also not know, dear Americans, that in addition to my degree in religion, I also have a degree in international politics. I actually know the theory behind communism, socialism, democratic socialism, all the things. And I would just like to say to all of, it sounds like mostly white men on the internet right now saying that we are about to vote in communists.
First of all, there's no voting in a communist, right? They just take it.
Right. You don't, in communism, you don't get to do that. But also, if you're trying to be funny, it's not working. It sounds like you're being serious. So I would encourage you to be more funny if you're trying to be funny about us all being communists, because we have a whole long way to go before we have central planning where you can't even pick your career and we're doling out cars for people and things like that.
I think that's my favorite thing, where your job is chosen for you. Let me just be clear. There is no thought leadership of venture capital in the job assignment like pool for communists.
Yeah.
So a lot of people are going to find new jobs real quick if their thing is thought
Yeah.
leadership on LinkedIn. Like, calm down.
Now, while I do think I do think the pied-à-terre tax is
Mm.
bullshit. I think if you bought something, no one should be able to make you pay again for something. I think that is bullshit. However, that is a very far cry from actual communism.
Okay, this is a sidebar. This is a sidebar because I'm mad about it, but we will continue now with our very, very long news show. But
we'll get
fun
back.
times.
We'll get back to that. There
We'll
is
get
a
back to
small
that.
placeholder for Lisa to continue ranting about this, and for me to talk to you about the coup on velvet boots, which broke up the Czechoslovakian, I would say empire, but other people would just say state. So
That's right.
Okay, yeah. As we said, as you can see, we did not plan this deck well, and this is a beautiful slide of Krista, who is going to be coming back later to talk to us about the Coalition to Advance State AI Sandboxes. We got some other AI news that happened this week. Which we'll get to right after this slide. So the FDA commissioner has been chosen to be nominated. No, she's not like in yet. She got to go through the Senate confirmation process. Heidi Overton of the DPC.
Yeah, I mean, this is just one other, if you're to ask me, like nail in the coffin for the MAHA coalition or whatever it is. Because I don't think they're big fans of Heidi or Dr. Overton. I think she is a medical doctor, Dr. Overton, as far as I understand. So, yeah. Yikes.
I have met Heidi. I like her. I think this is an interesting choice just because it kind of wasn't on my radar. So we'll see, but it sounds like based on all the coverage.
I think we talked about this one, and there was kind of we were saying that there was a ballot stuffing campaign to confuse the press and the public, right?
And then we even talk to some people who actually know stuff, which we do sometimes, and they were like, yeah, it's real but not real. It's how we always see 400 people nominated for everything at a time, or suggested to be nominated. So I mean, yeah, let's see how it goes. I mean, the hearing won't be till she gets back or they all get back from Congress comes back to their real jobs. So we'll see how that all goes. But we'll see what happens. Speaking of the FDA, they are seeking public feedback on the regulatory approach for generative AI-enabled medical devices. Lisa, what do you think? This sounds like, I mean, this is kind of pro-business as far as I can tell.
Yeah, they were basically we don't know how to do this, so you should tell us. I also don't know how to do this, and I actually don't even have any idea what I want to tell them, but I'm just a little bit concerned. Mostly because I don't think I want generative AI in my medical devices. But yeah, that's my first reaction is I would not like any generative AI in my medical devices.
Well, I don't know. I really just don't like regulation in general, as you know. So
This is perfect.
in here, broad brush summary is it does appear that there's some lean toward being more lenient with the great free private sector as opposed to being more hardcore about patient safety, which, I don't
love it. I don't love it.
If I was running a generative AI medical device company, I would be totally into this. But I am not. So
yet.
But great news, America. You can comment and tell our American government what you think about that. So
that's right.
If you have concerns about that, if you have big feelings, if you do not want the Gen AI in your medical devices, you should probably send in some comments.
Great.
Yep. Okay, speaking of AI, and maybe our guests can comment on this. So I actually read this because, we do a bunch of work in public health, which I'm totally into, love public health. I actually paid for an APHA membership so that I could read this whole article because I was only reading the first page. And I thought it was the dumbest first page I've ever read that literally said nothing. And everybody's clapping themselves in the back on the internet, all the public health people. And listen, public health people, I love you. I'm trying to help you out. You know that. But this article literally says nothing. You know what this says, Lisa? It says, we tried to implement Claude, an out-of-the-box solution, in our public health departments. And out of the box, it could not equally generate a public health report.
Yeah. Not really very surprised.
Without a person helping it, without someone in the loop. And I was like, well, no shit. I didn't send her. We can't. We can't implement something without actually telling it what to do. I think this is the dumbest thing.
Yeah.
And then I was like, is this all it takes to like get published in the American Journal of Public Health? Like, I'm sorry,
Yeah,
y'all.
you should write
Like I
something.
said, I'm trying to help you people out. I'm trying to help this whole industry out. You got to stop publishing stupid stuff. This literally says nothing. And also stop congratulating each other. It's like VCs congratulating each other on Twitter. Stop it. Do something
and also
real.
it's also kind of funny because it's like clearly behind the times. Like we've already moved into the backlash phase of token maxing, like where people are like, token maxing is dumb. Why are you giving all those companies your money? You know, and it's like we've already like we're like a couple cycle. They're like at least a couple cycles behind. To be clear, it takes a long time to get research published, all that kind of good stuff. But like it's just funny because we've already gone around the cycle here of like, why would you give like a general token maxi tool when you could like build stuff with like, for example, what is like appropriate for a public health agency? Like open source, open weight models that cost a fraction of the big, obviously that's a better match for like public agencies and public health agencies than like the most expensive token maxing, like Sam Altman, Dario Amodei, like money machine, you know?
I don't even know what you just said, but you sound
Great.
like a tech pro, and I'm into it. Whatever you just said, it's like everything everybody else says on the internet. Hold on, Catherine's got something smart to tell us. This was for this is on the proposal we were just on, or the public comment stuff. Catherine, who has actually read the proposed rule because she knows stuff, she said they also suggest AI overseeing AI. I don't know, America. If you feel strongly about that, I think you should let your opinion be heard.
I'm not a fan. Whatever. Not a fan.
Okay, Lisa, big dramatic news of the week is, which I think a lot of people already knew, the FTC is probing Epic for antitrust.
Yeah, I mean, this has been going around for a while. I think that the story went wide last week during Epic's user group meeting, UGM, their big Epic Palooza at the annual meeting, right? And so it is a little bit funny that the FTC went wide with the story during UGM. Feels like an impossible coincidence that it would be at the same time that would go wide. But I don't know. You know, I love when people are a little bit shady. I love when people are a little bit shady, and this feels a little bit shady. But I like it.
Things happen all the time. I will say, and also people are like, oh, why aren't you guys at UGM? Did you not get an invite? The real answer is no, we didn't get an invite.
No, we didn't get an invite. In case if you're a long time watcher of the show, you know that we have been to Epic before as invited guests, and we had an amazing time. It was totally crazy. But no, we did not get an invite, and I'm guessing that me, with my loud mouth and my various alignments, will not be getting an invite again. However, I would love to go. Because they have farm animals that I like. They have like a petting zoo.
We did have a great time there when we went. We stayed in that Staybridge Suites together because like nothing else is open. Because even our first invite ever was very last minute. So we had to stay like 12 miles away or something in like an apartment together, which was fun, obviously.
It was fine. It was just hilarious and very low rent because there is like already not nearly enough like hotel capacity in the area. And then for UGM, it's like insane. It is booked like 4 years in advance. So we did not stay in our typical
no one even called us this year. Last year they started to invite us and then abruptly rescinded their invitation. And then this year, like crickets, like no one even called us. Like no one even accidentally emailed us. Like they were like,
I just want to be clear. My primary interest in going again is because I love a petting zoo, and they have an entire petting zoo. They have goats everywhere. I love goats. They had baby goats at the time. They had horse rides. Like this is like a vacation for me, just to be totally clear. So I'm interested primarily in the petting zoo, but that's fine.
I mean, Epic can invite whoever they want. Like, that's cool. I know they did invite Brittany, who had just published her story about them. And
did they rescind it?
She posted, I believe she was there because she posted from the airport eating a burrito on her way to Madison. So, you know, I mean, like, God bless America. I mean, one of the problems maybe, Lisa, is that we did very much intentionally try to escape all of our handlers the first time we were there.
That is true. That is true.
We're not very good at following instructions. We're fake media and a bunch of shit talkers. Okay, so what did Epic say about these claims? What did Epic say? We didn't do it.
Yeah,
It
I mean, I
wasn't
think their stance
us.
their
Nope.
stance is very much we didn't do it. Yeah. Their
Yep.
stance is
Not
we didn't
us.
do it. Yeah. Yeah.
Nope.
Yeah.
Nope.
Yeah. I get
We
it,
are
you know.
not in violation of U.S. antitrust rules, which is probably what I would say too. So
Yeah,
yeah.
I mean,
So we'll
I think
see what
it's a
happens
reasonable
there.
response. It's a reasonable response, right? Like it's not illegal to like have a market share or controlling market share, right? That's not illegal, you know, as we know. Um, so now the government has to prove if it is going to try to try to prove that they were acting in a way that is in fact against the law, and we'll see what they do there.
You know,
But
we
yeah.
yelled about asking to come on our show. We would go, Lena, come on our show. You know, she's no longer in charge of the FTC, but like, she should still come on the show.
She should still come on the show. And by the way, the person who I was subtweeting there at the beginning of the show is Eric Larson from Tower Brooks, who went on an entire rant about Lena Khan at the end of his webinar with Blake from Hospitality
But wait, we have a slide for that,
yesterday. Oh,
Lisa. I
sorry,
just
but
don't
but
know
he
where it
but he was
is.
but he was like Lena Khan, Lena Khan. So he's still holding a grudge. Is what I would say.
Lena Khan, come on our show.
So come on
Okay,
the show,
maybe she'll
Lena.
hear us
Seriously,
eventually.
what do
Yeah.
you have to
Okay.
lose?
Okay. Also, kind of hilarious thing that's kind of related to oversight of some AI things. This is I actually, so Brendan, I love your memes always, and I wish I was creative enough to do them myself. But I was like, wow, that's like totally true. If you look at this little horse thing here, it's like regulation in our world is like, you know, like my 4-year-old. Well, no, they're not that, but when they were 4, drawing this horse, and basically giving an overview of the AI COA or whatever rule it is, which is about like basically antitrust stuff, competitive practices with big tech platforms. I really, after I read this, only included it because the horse, because it is very unlikely that this law will pass. It like they
It
tried a
sounds like
couple
a bad
times.
idea that was cooked up by
Yeah.
someone in the back corner of an office building.
Yeah, I mean, again, I'm kind of anti-regulation in all ways, so anti this as well. But um, anyway, Brendan's stuff is always fun. Check it out. Also the memes. Okay, yeah, big like exciting news that was all over the HTN yesterday. Is there's going to be a City Block announcement. Keep refreshing this page to find out, and then it turns out City Block had bought Homeward, which I think
Had
is
a
interesting.
Series E, and
Oh,
also
Series E,
so
116
they
million.
100, yes, they had closed their Series E and they acquired Homeward. And the funniest part for me was the commentary about what their new name should be. So first, one of my colleagues, social media knows that it should be called Town and Country, which I was crying
Stop.
to. And then the
Stop.
other one, I think it was Martin on HTN. He was like, it should be. He's like, well, City Block and Country Mile, like a country versus
Oh
City
my
Block.
gosh.
There were
I
so
didn't
many good ones.
That is
Country
really good.
Mile, Country
I
Mile makes
didn't
total
even
sense
know
for your
that.
City Block. Country Mile, amazing,
Town and
amazing.
Country is really
Town
good.
and
Well, yeah,
Country.
so okay, so a couple of thoughts and obviously I'm now frozen on this hilarious comment that that both of us saw on the internet by a hilarious individual. And congratulations, acquisitions are always exciting. I thought that City Block was very much struggling to achieve a revenue positive or revenue positive in the future-ish position. I think it is awesome that City Block started. I think it's awesome that they're trying to deliver new models of care. I do not know how they're effectively making the big cash money that would attract big time investors in this current universe that we're in. And Homeward and City Block is so hardcore Medicaid. And so for me, I was kind of like, oh, now we got the Medicare.
So City
Confusing.
Block, well, if you actually listen to the interview that Kevin from HTN with
Obviously,
Toya and the
that's why
CEO,
you're here,
she talked about
Lisa.
the fact that they have now an extensive amount of experience with dual eligibles, right, and those who are in essentially Medicare Advantage, special needs, whatever plan. So they claim that they now have a good amount of experience with Medicare through dual eligibles, who are Medicare, Medicaid, low income folks who are in Medicare. But but it's exactly that. Their model is primarily / exclusively urban areas. It is all centered in core in Medicaid populations. It's all centered in core in a higher level of need and an in-person delivery mechanism as well. Like And then they're combining that with Homeward, which is Medicare Advantage plus rural. And so, I mean, you can see, like, you can make a map and say, like, okay, maybe this could work. Holy smokes, the implementation of that is like so hard. So hard.
Yeah. I
So
don't
hard.
know. And I don't know if there's like weird math going on here because everybody knows I am just a woman. So I might have the math wrong. But the math does seem weird. And I think this is one of those situations where, like the insurers post a massive loss, but everybody still makes money. I feel like, I don't know.
Somehow.
But yeah, acquisitions are great. Businesses are hard to start. I don't totally get it, but again, like I said, I am just a woman. Listen, you can go to Costco now. You can go in for the rotisserie chicken and get a total deal. You can buy Medicare Advantage plans, and you can also walk out having babies now at the Costco. Wow.
First of all, me and everyone, I adore Costco as a business. Like, they're just geniuses. And they're so, 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 so focused on their employees and their customers. And they're all about things like they've been doing tons of stuff around drug pricing.
Just like Delta.
I love them so much for that. Except for Delta is like, how can we make more money off you? And Costco's like, how can we save you money?
I know, but like the way Ed Bastian says that he's made so much money off me just makes me feel good.
Oh my God.
I hope he never leaves.
Costco,
oh my God.
He's going to leave. Costco is
I
a
don't know what I'm
great
gonna do.
company. I love them, and like, shout out to them. I don't really care particularly about fertility drugs, but a lot of people do. And so I'm sure this will make a big difference in their lives. And that's what they're trying to do. They're such a great company. Just shout out.
Go Costco, doing the things, serving America.
Yep.
Now we're finally talking about communism, Lisa, but like we've talked about the communism so much.
I know. If you want to read it, I think it's 365 pages. I have not read all of them. Absolutely not. But he did summarize this yesterday in a webinar with Blake from Hospitology, which was fun to comment on live with our friend Lucia Savage, and a number of other fellow travelers. It was entertaining. Short story, like, I think he's really, really short on payers in the AI future. I think he's long on payviders. He was like, if you're a health system, like, don't sell your health plan. Like, payers really just need to become like very like automated, agentified, like rules-based, whatever, like take out all the friction. That's the vibe from this. But he did also, again, take the latter half of this webinar to yell about communism and the second home tax in New York City, which was very funny. And I laughed at it. And I was like, okay. I don't think that there's a job in communism for the thought leader like this. I think they're going to reassign that to no one.
Yeah. Well, they might reassign it to one of their friends because that's typically how central planning works.
Yeah.
But
he might be a friend.
I will say, at base theory, communism sounds like a wonderful thing, which is why I think it worked so well at the beginning. And then like if you actually like, it makes sense that everything's fair and we have the smartest people plan things. But
no, we don't. There's never the smartest people.
Obviously, I'm not into it because I think let the strong survive and all that. But like,
I think we should just focus on stopping to subsidize like bad ideas here in the United States of America with our current government. And we do a lot of subsidizing.
What do you think we should do about our $40 trillion debt? Speaking of
that's a problem. I don't actually know the answer to that one, but it feels like a big problem that nobody is particularly caring about anymore, which is a little concerning.
I don't like being in debt.
A little concerning.
I don't like that.
Anyway, this is a big idea. Big man, big idea. Read it if you want. The gist, as far as I understand, is like really that, in this world of AI, like days are numbered.
We should write a manifesto.
Yeah, we should.
Yeah. And then we'll go on a healthcare technology media tour and talk about our manifesto.
Amazing.
Okay. Yeah. No surprises act. Has anyone seen all the NSA stuff where the payers are super pissed because they're getting, the IDR process is resulting in most of the hospitals winning. It is overwhelmingly a good thing for hospitals from a revenue perspective. Payers are mad. And I believe AHIP itself is doing most of the lobbying and heavy press about how the NSA should go away or be like massively amended. I think there's there have been either there's a proposed rule out or there's the final rule is out. I don't remember for the IDR process. That was in like May or June. But yeah, I will say what I want to comment on here is like, AHIP, you are super smart because they keep using these like adorable state plans as the reason that like the NSA is so horrible.
It's so great. I would
It
not
is
go
because
up
like it is
against them
sad. Like
from
I
a
think like
lobbying perspective. Oh my
they
God.
got hit with like 18 million more or some outrageous percentage more than they anticipated because of the IDR process. And it's like one standalone ER in this story that just keeps submitting claims and winning that they have to pay. But I agree that does suck. And I do think the IDR process needs a little bit of love. But I also am waiting for the story where Big Bad United is like, United loses small percentage of money and is mad.
Yeah, I mean, the problem is that like there's no like first of all, like I think we even have talked about on the talk show these like freestanding ERs are just like whoa, like hugely problematic. But whatever. Like beyond that, the whole No Surprises Act and the like dispute resolution process, it's clearly like it was maybe a good idea that like immediately was corrupted by like finding any hole. Like it was just like immediately like not able to do what it was supposed to do and come immediately just like ugh, okay, never mind. That was nice try policy idea. It's not working.
Yeah. Well, Lisa, as you mentioned, everything falls apart in implementation. Execution
That's
does not.
correct. That's correct.
Kind of like
Implementation is
communism.
much harder than policy.
Kind of like communism. What? It's so
Yeah.
confusing. Oh my God.
Yeah.
So weird.
Exactly.
Again, I am not a communist. I'm very anti-communist.
You have to
Okay.
say
Yeah.
it.
Oh, we got another tempo thing going on. Limbic. Isn't this that guy that we met in DC? What was his name? Mark Gruner or something?
I don't think so.
Anyway,
I think this is
I
a
don't
small
know.
company out of the UK, which was very surprising for
Oh.
me. I'm pretty sure this is a very small company that like got themselves accepted into access, and then we're trying to figure out like how do we enter the market. I mean, like good for them if they got their their device accepted into Tempo. I think this makes 3 companies.
I think it's 3.
I gotta check the list. It's
And
gonna
I think
be
this is the first mental health one.
yeah.
So,
AI led mental health, AI coach for mental health. It's a risky area. Let's just say that out loud. If you've been following the news about Chat GPT and mental health, it's not good, right? There's a bunch of really crummy stories out there. So
I don't know.
this would
I
not
can't
be
even
the
talk
area
about
I'd
mental
go.
health.
Yeah.
Because if we talk about
Bad.
mental health, Melissa will start telling us the latest conspiracy theories on the Lindsay Clancy trial, and I will spiral into like next Thursday. So we're not going to do that. All right.
This feels concerning. Anyway, yes.
Yeah. Shocker, America. We are paying more for healthcare, much more than ever before. And next year will be worse. Thank you to my favorite publication, the Wall Street Journal. Appreciate that. Also, strange news in consulting and lobbying land. McDermott Plus is shutting down, which is interesting.
We know a lot of people there. I'm sure Krista does too. It's some people who've been around for a while. One of my first contacts in the DC policy world, Rodney Whitlock, a legend in the space, who used to chop it up with me on Twitter back in the day. He is amazing. So just a good times.
Yeah.
Sorry.
And this is the regs and eggs guy, right? The regs and eggs guy is McDermott Plus.
Jeff Davis.
Yeah, I will say, sir, love that newsletter. I salute you. I hope you can continue writing the regs and eggs somewhere else.
Yes.
Lisa talked to a very cool individual and recent invitee to Interesting Person Party, Verlon Johnson, who is on the MacPac, or she leads MacPac, right?
She is the commissioner, I believe, still.
Oh.
Yeah. So she's just fantastic. Has a great set of experience in the Medicaid world, and leads, I think, like something really fun, like external affairs, corporate affairs, like the full thing for a center, which is a massive Medicaid focused technology firm and consulting firm. So she's just like great. Wealth of information, has really good perspective on what's next for Medicaid. Check out my other podcast.
As always, if you would like to see Lisa in a well-produced setting with Wi-Fi that mostly works, you should go check out her podcast produced via Innovacer, the Healthcare Policy Stack. Finally, Melissa, did her
Okay.
own solo talk show earlier this week at the
Mhm.
National Indian Health Board with Robert Coffey. They did a collaboration, Coffee Talk and the Health Tech Talk Show. Melissa, tell us what we missed. I didn't miss it, but
I was going to
tell
say you
everyone
were
else.
on it commenting. I had a really good time. NIHB was kind enough to give us a room with Wi-Fi. We did not have our normal issues. It was like amped. It was great. We had Chance Rush on there, who was the master of ceremonies last year and this year. He's also a published author, a runner by profession, a comedian, and some other really cool stuff. We also had Nicholas Barton, the executive director for Southern Plains Tribal Health, and he was discussing the importance of the work that they're doing for grants and the EHR feasibility study that they're pushing forward through Incenna.
Yeah.
It was awesome. Yeah.
Awesome. Well, look forward to Melissa doing more of these things on her own because she's the one who keeps the camera. So we'll see what happens
Yeah,
there.
he's never tired.
Yeah. All right. All right. Thank you, Melissa. I have one more slide. Oh no, I thought I did. It was just Krista's slide again, but everybody knows she's coming. So we'll get rid of this. Hold on. We'll get rid of Melissa. We'll bring Krista on. Oh my goodness. Krista, how would you rank the Health Tech Talk Show on a scale of 10?
On scale 11?
That's what I'm talking about. That's what I like. Although we're great at criticism if you want to get in a fight. If you want to say it's like a 2, it's fine too. Yeah.
My daughter, I don't know, she's a teenager, and these days it's, you want to go? You want to go? Like as a fight. So I feel like I can go now. So
okay. Well, we can if you want. Maybe we'll get in a fight about state AI sandboxes. I don't know. But
I'm hoping to be as non-controversial as possible.
I think, well, I have a lot of questions in general, just because I'm super interested in like all these initiatives on AI. And I feel like everybody's trying to do something and race to the end. And there's been the whole chai controversy and all that. So just maybe start out by, well, actually first, tell us about Serrana Strategies. Cause I think like most of our friends work with you, including Lisa and all of Lisa's friends and all of my friends. So yeah, just tell us briefly about that, and then let's jump
Kristen and
into.
I are very policy focused. So we do lobby. I used to work on the Hill. I worked in CMS and could navigate my way around Washington pretty well. I also worked at the state level and also ran the National Governors Association's health division. So we can find our way around government, but what we really like is what are the policy solutions and how do we craft and ask. So I think we're just particularly good at in diving into the details. So that's probably why we work with a lot of your friends. We do digital health, health IT, value-based care, alternative models of care, care in the home, remote monitoring. So we're trying to look at the future. That's what our mission is, the future of healthcare.
Awesome. Well, speaking of the future, what's going on with this coalition?
AI is going to be part of it, whether we like it or not. So, we've been watching all these conversations and developments, and we're sitting here thinking everyone's talking about the regulation of AI, but what about healthcare regulation? Like these long-standing structures of licensure, scope of practice, medical liability. All of these healthcare regulations are going to be what the problem is for AI, not AI regulation necessarily. And so the sandbox is a way to do a supervised temporary pilot of a solution in healthcare that could potentially be semi-autonomous. So right now we have, you could go a long way with physician supervision. So you could have an AI, bot do quite a few things as long as the physician oversees it. But if an AI solution does everything and the physician spends 30 seconds looking at it, the physician is still liable for it. So you could go that route, or you could work on a pilot that has a lot of data that proves to the state and to the medical board that this solution is going to be a good thing, and find a regulatory pathway forward where you don't necessarily need the human supervision. The reason why we're talking about this now, and because I've obviously listened to you and heard what you said about, the generative AI FDA RFI, and we may not be there today with AI that we would trust it to be autonomous, but in 2 or 3 years, we might be. And I think what we do know about government is that it works very slowly and there are very finite timeframes. So at the federal level, if you want to get in the physician fee schedule, you better come in December, January, and not in June. In state government, we have very finite state legislative sessions, and some of them are only 3 months or less. And some states, like Texas, only have them every other year. So if we
Right.
don't pass sandboxes in 2027, we're looking at 2028. But think about the time that it takes them to implement it and hire people. So then you're talking to someone in 2029. So if we pass sandbox legislation in 27, they hire people, do the implementing regulations, we might have somebody to talk to in Q1 of 2028. So I'm saying between now and Q1 of 2028, who knows where we're going to be with AI. And so trying to convey the urgency of now on this is somewhat difficult when many AI developers and venture funds are saying, well, we're doing fine just the way we are, and we're not sure that we need this.
Well, and they also frame it like it's really bad if we have individual things happening at the state level. We only want basically nothing from the federal government. We either want something specific or we want nothing, like a free and open pathway. And that anything happening at the state level is negative and it's too much to handle. Like that's the vibe or the specific words, honestly.
But even in those conversations, Lisa, they're not talking about specific healthcare regulations.
No.
Like, oh, you could do all the stuff they were talking about with preemption, but you still have a licensing and scope of practice issue because the state government is what actually regulates, can you do this, like the practice of medicine. Right. So while the FDA is essential and does a lot, you can't just be, software as a medical device and operate in the market. So without human supervision.
I don't know that they know that, Krista. They may just not know that. Can you guys hear me? Uh-oh.
Yeah. AC Marriott, it's coming through. Yeah. Just a little bit.
I think it's because the T just drove by and it probably just like smushed the fiber optic cables.
Yeah, that's probably what it was. They ran over it. Well, yeah. So that's Lisa's point. She's saying, they don't necessarily, maybe they don't know this, right? And I would agree with that. A lot of these technologies, right? In many cases, they maybe weren't in healthcare and are coming in, or everything's moving fast. The other thing that I will say, and I'm interested in if you agree with this, is I, worked in a amazing startup, which I remember very fondly, where we focused on the states, and even a lot of our investors were like, the states are too hard. There's 56 of them, depending on how you look at them. And let's just focus on Medicare, right? Because it's a federal program. It'll be easier at that level. And so I think they get pressure from investors to not focus at the state level when they don't totally realize that that's where the action happens and that's where you actually get traction. The other thing I'll say is I think this is going to be like semi-inappropriate, but I haven't had time to think of how to say it otherwise. I think a lot of these CEOs of startups go to DC and they just can't wash the smell of the swamp off of them. And it's just I'm actually not going to say it's like it feels so exciting for them and they feel like they're making progress, and you can go in and have a billion meetings with important people who are going to smile at you and say, oh yeah, and then it doesn't happen. And I think they don't realize that that's a waste of time in many cases, and that they should be spending time in some innovative states to prove these things out.
Hey, Kat, this is why people work with Sirona, because we tell them, don't go up and waste your time with all of these
meetings. You go.
You need to actually dig down and figure out where is the problem that I need to fix. And sometimes you can go fix it with someone 3 levels down at CMS. You don't need to go talk to Senator so-and-so. So we want to solve problems.
Everybody wants a meeting with Senator so-and-so, and you're not going to meet with him anyway. You're going to meet with his health policy intern. Yeah. Shout out to my niece who's a health policy intern. But she love her, but she did literally just graduate from college. And she's very smart, but she also is not Senator so-and-so.
Yeah. Yeah. Well, so Kat, you mentioned Kavita before we started. Kavita had a great, Kavita Patel, for those of you who don't know, she's amazing. She had a great
the
idea.
Oracle, depending on.
She is. She had a great idea and said, you know what, if we can't get them to understand the importance of the state level, let's invite them to Washington and have the FDA and CMS and ONC and ARPA-H come to tell them how important the states are. And how, I mean, obviously we need to know what the federal government is doing, but also so we're inviting state officials to come too and try to explain the differences between the roles of the state and federal government, because FDA is essential, but each state has their own licensing structure. And Kat, to your point about 50 states, my experience at the National Governors Association is if one state does something successfully, that it's much easier to take that model and run with it. So we're going to try to make it cool and popular in 2027 to pass AI sandbox legislation so that we get a lot more in 2028. But right now, everybody's running to Utah because Utah is the state that has the ability to do it. I highly recommend that if anyone is interested to go to the Utah Artificial Intelligence Office website. They've done us all a favor by being very transparent. You can read all of the contracts. So you were talking about mental health earlier. They're working with Eliza Chat, which is a mental health company. They're doing prescribing. They're doing dental cavity diagnosis. Those are all things you need licenses for. And they have contracts with these companies that are really, really interesting. They're figuring out what population is appropriate. What is the intended use of this AI tool? In auto prescribing, or not auto, but AI prescribing, they're saying, okay, what drugs are appropriate? They have to be maintenance drugs. An AI bot can't originate a prescription. So I think those contracts really put into stark relief why we need sandboxes, because you just can't do all those things without a sandbox.
Yeah, for some reason, I don't know. It's like the Department of Commerce or something, right? It's not
Department of Commerce.
It's for whatever happened there, just the right magical alignment of people and leadership and whatever. They're we're gonna just jump into the breach, and just start. Yeah. It's really cool. They've been so innovative about it, and then just being transparent is so neat.
We had a webinar with them. If if anyone's interested, it's on our website, aisandboxes.org. And they basically said, we want other states in the fold because we don't have all the answers. We're wondering what to do about liability right now. And it'd be really nice to be able to call up another state and see how they're dealing with it. So I do think they are feeling the impact of being the only one because they don't necessarily have all the answers. Delaware is about to jump in. Texas will jump in. But yeah, I mean, we need more states working on this.
Yeah, and more states with a little bit more. I love Utah. I spent a lot of time there. I commuted there for 3 years. Big fan. It is a small state population-wise with a relatively homogenous culture, right? So I do think something like that it's a great test bed. It's a great first one out the gate. We do need states with different, more diverse populations, I think, to prove some of that stuff out to make sure that it'll work more effectively. What does the coalition actually do? Are you setting up different pilots in states? Are you helping states pass legislation so that they can be these sandboxes?
Yeah. So first we have to recruit the states. We have some in mind, but we want to recruit the states to be interested. And we need both the executive branch and some champion legislators. We need model legislation. We would like it to be healthcare specific. Again, because there's just so many issues in healthcare that there's fintech sandboxes already. I think there's 7 or 8 fintech sandboxes. So we could just have sandboxes for all different kinds of issues. But the idea of having a specific healthcare sandbox is very appealing. Then we want to go out and recruit the champions. We're going to introduce the bill, get the governor's office to support it, get stakeholders to support it, write testimony. Do all the sausage making, working with lobbyists on the ground to pass. Our goal is 5 bills in 5 states. So
awesome.
That might sound small, but it will be groundbreaking because then we will have 6 total with Utah, and hopefully that will create a snowball effect.
No, I do not think that sounds small. I do most of our work is in the states, and I would need to be paid like several $1,000,000 by one client to say that I would get anywhere close to 5 states in a year. So
By the way,
it's
it
very
is
impressive.
okay. You know.
Well, I'm not passing laws or anything. We're just doing deals. But even still, it's really difficult because
Yeah,
each one is a little different. But to your point, many of them do follow each other.
very much.
They kind of go in clumps, and they're the ones that I think, there's what I'll say about that, though, to your point about sometimes it's someone 3 levels under at the federal government who gets something done in the agencies as opposed to the flashy person. Same thing in the states. Sometimes it's just, that career state government employee who believes in their state, who has a relationship with Delaware or whoever it might be. And they're the ones who share that information and get things moving. So I think that's
Well,
very
Utah
cool.
is very willing to help. They want more states, so they will lend a hand and try to encourage others to do it. So that does create some level of safety when you can tell your boss in state government that Utah's done it and they're willing to help you. So
Yeah. Yeah.
Yeah. Well, there's lots of precedent for, for similar laws across states. Like you were just saying, people like to have a template, CCPA for better, for worse. And then lots of other things. Then you have states like, let's say, California, who are going out really hard against the MSPC, the friendly PC model around, owning corporate practice of medicine, owning a clinic as a non-regular healthcare provider, all kinds of things like that. There's so much precedence around that. And yeah, it's good and bad that Utah is such a small and homogenous state for this. They obviously had enough like trust and alignment to do this work, but then now you're going to have, it is still a leap for a bigger and more complex state in terms of people, population, location, et cetera. So it'll be interesting.
Lisa, right after high tech, I was working in Illinois. I was given the job to figure out how we were going to facilitate health information exchange. I was ready to build the lunar landing module and realized that really what we just needed was doctors to be emailing each other PDFs, at that point. But I went and visited Vermont, Indiana, and Michigan because they were already well on their way. And Vermont was amazing. But I just said, like, we could never do this in Illinois because Vermont is just such a special small place where all the important stakeholders are on like one street in Montpelier, and you can just have everybody get together at a coffee shop and work it out. So I agree with you on the small state versus big state, but it does take leadership. And Kat, to your point, there's going to be somebody in one of these 5 states that has to take the reins and help make it happen.
Yeah.
Mm-hmm.
Yeah. Well, I think, I think especially with how hot AI is, you're going to be able to do it, especially with Utah leading and the attention that they get. Although, what did happen with that drama with their medical board? With
well,
whatever
this is
happened with that?
interesting because we had our webinar and we had overwhelming participation by medical boards. Medical boards are very interested in sandboxes, and we want to work with them because they're obviously very invaluable in regulation of healthcare, but there has to be some path forward. And so Utah, actually, the medical board is very much overseen by the government, and is, essentially, in every state you can trump your medical board, but in some places they act much more independently. So the medical board sort of wasn't brought in early enough, I would say. And I think Utah would say that too. So you have to bring the medical board in early in these negotiations. Yeah.
This is all a classic Overton window problem, right? Like they're doing the little tiny, like Utah's work has already like done a tiny little shift of the Overton window. And now we need like a bigger push and a bigger push. And, some places will like never open the window. Some places will open it all the way, right?
Yeah. Well, we hope to find those places. There are some states with, Arizona brought the idea of sandboxes over from the UK in 2018, maybe. And they set up a fintech sandbox where, the digital wallets of the world wanted to pilot their ideas, but they didn't want to go become a bank. And all the banking regulations were standing in the way of trying out your digital wallet. And so they said, okay, we're going to let you test this digital wallet outside of the banking regulations. But if it's successful, then you're going to have to go get regulated. In this case, healthcare is a bit different because we're saying, okay, you're going to test this, but you can't really go fully get regulated because you're never going to be licensed as a human, human practitioner. So we have to kind of find a different way. But the first thing to do is to see is this going to help our population?
Yeah. What about I mean, I am very pro state, as everybody knows. What about the executive order on AI legislation in the states?
Yeah, well, the problem is that these are long-standing structures that we're talking about. I remember during the pandemic when Vice President Mike Pence, said, "Oh, we're going to waive cross-state licensure," and my phone started
Yeah.
ringing off the hook because, as part of our digital health work, we'd always been trying to get states to agree to allow for cross-state licensing. They don't. The federal government doesn't have authority to do that. Like
The
the
states are
states
going to do what
have
the
to,
states are going to
they
do.
have to decide, and California will never be part of the nursing compact because they don't want any nurses practicing in California that aren't licensed in California. So it's a state by state endeavor to try to get, licensing. So there's no thing the federal government could do that would waive state licensing.
Yeah.
And I
And
don't even
as
know
Congress
like
is
what
not going to preempt state law on licensing. They tried that back in 2015. They tried to make the Department of Labor in charge of licensing, and it was a disaster. So don't think it'll
it's
happen.
so funny, right? I mean, I was just thinking about this company, Limbic, that we were talking before, UK company, any of these companies coming into the US, like as Kat and I have talked about many times, like a lot of, health tech folks from outside the US, Europe in particular, think like, oh, the US has this big pot of money and like we're gonna bring our technology there and it's gonna be great because look at how much money they spend on healthcare. And here, meanwhile, we're just all like dying of huge cost overwhelm in healthcare. And they're like, we're going to get some of that money. And it's like, the US is not just the US, man. We got 50 states. We got way more than that in terms of Medicaid jurisdictions. And the rules are often different in all of those states. And like we've been saying, like we always say, that's by design, right? Like
Yeah,
it's by design. And this is just another great example of like if you just read the headlines of like, look, the president has like made it illegal or passed an executive order that says we can't do this, it doesn't really matter like in terms of what the states are
yeah,
doing. It doesn't
Yeah.
matter.
but that's why I feel so much urgency. Like
Right.
I feel urgent about this because I'm saying, guys, just in the best case scenario, we're not talking to anybody in new states until Q1 of 2028.
Mm-hmm.
I mean, that's a year and a half from now. Like, if we don't
Yeah.
pass legislation next year, like, I don't know what people are going to do. We're just going to have to continue to always have humans involved, even though in some cases around the edges, there might be things that AI can do that don't need human oversight. But we will never expand care in that way if we don't have a way to do it. And I don't think that there is another way. I mean, there are other ways to do it, but politically infeasible ways to do things. I think sandboxes is the most politically feasible way.
Yeah.
Mm-hmm.
Yeah. I'll say, working with a lot of companies that like to spend a lot of their money on the national level because they think it's going to be easier in some ways. So they feel like they have traction because they're having meetings. Back to that point, I will say not in AI because it's relatively new space, but in various other parts of the healthcare industry that are a little bit newer to the market. The companies that win are the companies that have market and the companies that have traction. So in most cases, those are the companies that are working in the States and they're foregoing the fancy stuff in DC and like going out to dinner and everything, which obviously I love doing too. And they are freaking flying to Indianapolis or whatever it might be and having a beer at the embassy suites, right? Those are the companies that end up making money. Those are the companies that end up getting traction. And ultimately, those are the companies that end up getting sold and on the talk show without us making fun of them. So
Yep.
I'm here for this. Like I think that makes a huge difference. What kind of companies should be participating in the coalition?
As much, I mean, enabling healthcare, honestly, like it's a pretty broad group of people. I think the people that would join are people that see their roadmap potentially going into the future of doing things that might make it possible to be autonomous or semi-autonomous. Um, it probably companies that don't have that today might not see the desperate need for this.
Yeah.
But I think companies that have a solution that, I mean, anyone really in healthcare who thinks that they might have a solution that would someday operate potentially in an autonomous
Yeah.
way.
Well, and it sounds like the not side benefit, like probably main core situation, if you take away the AI focus, is that companies that are participating can work with and leverage your relationships with several other states. That'll be pretty important in the next coming years,
Yeah,
which is hard to
you
do.
may not know this, but Kristen and I founded a nonprofit called the Health Policy Futures Lab, and we have
No,
been
I
doing.
totally know that because I follow you on LinkedIn.
Oh, okay, good. We've been
I've
doing a
been to your
lot with
conferences.
the Rural Health
Great.
Transformation Program, and we had 40, 45 states attend in person to our first RHTP meeting. And in June, we had 36 states. So we've gotten to know a lot of the states through that process. And I mean, working at the NGA, I've obviously, and in Illinois, have experience with states. So I do think that we are well positioned to make this happen. Um, I'm going to Charlotte, Kansas City, and Arkansas all in like a 1 week, in 2 weeks from now. So like spend a lot of time in states, and I think we can get it done. So
Yeah. Well, it's hard. It's hard to, because yeah, I know my team has actually sponsored and attended some of your Rural Health Transformation Fund focused events, and it is really, really hard to build relationships with the states, and it's hard to do this on your own. So I salute you. That's hard work. It is hard traveling to every state capital in America.
it is. I know, but I got to get to North Dakota and Alaska. Those are my two states that left I haven't been to. So I don't know.
Alaska
Oh,
is amazing and well worth the trip. I have not
yeah.
Well,
actually
they're
been to
doing
North
great
Dakota,
things
so
on
shout out there, but
RHTP. I mean,
They
yes.
Alaska is a
are.
leader on RHTP. So maybe I'll just have to go on an RHTP tour up there.
Yeah, you should call Brittany on our team. She just led a panel at MESC with I think two people from Alaska. We do a bunch of good stuff up there with their HIE. So they're doing stuff. Great team up there, and I hope you get there. Lisa and I used to go there all the time. We have many pictures of us drunk on the streets of Anchorage in the middle of winter.
Great.
Yeah,
It's a
we
great
often repost
place.
them. Yeah. Yeah. Okay. So what else? Like, what else should people know about this? When you say like the time is now, we have to do this. Like how now is now.
Okay, so we're having this meeting with the feds on September 9th, which I'm hopeful will lead into the kickoff of the Sandbox Coalition. We do have some committed companies now, but we need enough to really make this work. We have to, between now and December, when bill filings are, we have to write the model legislation, pick the states, find the champions, hire the on-the-ground lobbyists, like get all of this going before mid-December, which is again when bill filings are. Because once
Yeah.
the sessions start, the first week of January, they go really fast. And so we have a lot of work to do between now and the end of the year. And I would have preferred to start earlier, but here we are. So I think like now would be mid-September to get started.
Okay. Okay. So I hope you heard that, all of our loyal fans who have lots of money and are trying to make an impact in AI. You should do this because no one else is just going to make the states do stuff. Well, I shouldn't say it like that. The states do stuff that they see it's valuable. They're short staffed. They don't have a lot of attention span for things that are newer. They're trying to do things like deal with hospital closures and stuff like that. So this is really good work. And if this stuff is delivered by a trusted source, they often are very willing to collaborate. So strong recommend. Lisa, any last questions?
Nope. Just excited to see where this goes. Happy to help. And yeah,
Great.
we share your perspective about the importance of the states.
Yeah, God bless the
People
states.
can go to our website, as I mentioned, aisandboxes.org. We have a webinar that we did with Kavita Patel and Tom Lee from Galileo in Utah that I think is good. And then we have background information also on the website, and anyone can email me at kdrobac@aisandboxes.org.
Awesome. Well, thank you, Krista. Thank you for
Thanks
taking
for
the
having me.
plunge, coming onto the Health Tech Chat Show. It was
Plunge.
totally fine. Nothing bad
I
happened
mean, I
today.
wanted to put on my funny pants, but you guys just suck out of. You're just so funny that it's hard to be funnier than you. So
It's very hard to be as funny as we are. It is true. Yeah. Maybe we'll broadcast live later tonight when we go to the bar. So we'll see what happens.
No.
and
Redacted.
much funnier on wine. So
Redacted.
I don't know. We don't know what's gonna happen. We never know what's gonna happen. But thank you, Krista. Awesome to hear.
Thanks,
what you got going
Krista.
on.
All right, take care.
And yeah, reach out. Call Krista.
All right.
All of our other friends do.
Yes.
Thank you.
All right.
Happy
Have a great
weekend, everybody. Bye.